So here we are. We know that so let's do your left shoulder. Okay. I'll try to move a little slow so you can kind of see everything. Okay. So let's talk about adhesive capsulitis or true shoulder pain. So what we normally have in the adhesive capsulitis or frozen shoulder syndrome is all the ligaments start to freeze over, right? And so as a result, this ball and socket that is very dynamic and can move in every direction this way, and it can go up, it can go down, it can go this way, it can rotate in every single direction. What's happening is that it starts to literally, like water, freeze, and it just gets really bound up. Again, we talked about on the phone prior to this a lot of the causes and the reasons why this may actually be occurring. But what ends up happening with a lot of frozen shoulder cases is that people will have what we call radiating pain and true shoulder pain. Let's bring this up. So in true shoulder pain, we typically have pain that runs down to about the bicep, maybe to here, maybe to around the side here. But true shoulder pain never really passes the elbow. Almost every time. It never really goes past this area. So when you do start having pain that goes down into the forearm, into the tops of the fingers, things like that, we have to start asking other questions. And those questions are, is it a nerve issue? Is it a neck issue? Well, I can tell you for sure there is some sort of nerve neck issue for you, and there's almost never a shoulder pain without neck problems. Here's why. And you already know this. But if we have some sort of shoulder dysfunction that's going on here, that means the trap, the neck, and all the muscles that attach from here and upward and to this area have to start working a little bit more. So if this has to start working a little bit more, you're going to get a little bit more discomfort and compression through that area. Now, we did a test on you, and we did some what we call neurodynamic testing with you, and we were able to demonstrate the nerves that come out and go down into the arm. Typically, the radial nerve, what we did is when we kind of bent your finger and then had you go out to the front and then to the side, that last test, this is that nerve that gets irritated, and it goes all the way down. If you see where it branches, it can go all the way down and into the finger and the thumb. Now that's a superficial branch, but there's also another branch in the deep area, and so you can kind of see how it splits. So a lot of people will mash and roll out their other areas this way. So the superficial branch goes all the way down to the finger. And then you can see if you follow that down, it goes in down to the thumb and fingers. So that's why when we wrapped your finger around and then pulled it down and then brought your arm up and then to the side and then bent your neck away, we essentially did this. I'll show you what we did. Yeah. So what we really did is we took the neck injury and we just, you can see that green line, right? We essentially pulled it at this direction and we pulled it going down, and we irritated it in the middle. And so also what you notice is that as shoulder pain occurs, it will begin naturally to start to round forward and then and naturally do that. And what also will happen with the shoulder with neck injury, let's just say it's not a shoulder injury, which we already know it is, what you need to do is this will naturally shrug. So you will naturally shrug in this direction, and as a result, it will naturally do that because that naturally takes pressure off of this area right here because there's less stretch. So when you actually stretch this, it actually gets sometimes worse. What you what you did is you did a mechanical. Remember when I had you hold on to your own pec? You actually held onto these nerve cords and actually provided relief on them. So the question for us would be, but let me actually, before we go into that, a lot of times with neck injuries, as the neck goes forward and we lose that curve, it can create that compression onto the neck, and a lot of people like yourself and myself and many others will have this pain that goes down back to the shoulder blade here. Yeah, so a lot of this dorsal scapular nerve. Yeah, and these are remember the muscles that go up into the neck as well too. So they do play a vital role, and the nerve can get irritated as well. So let's just show you what it would look like if we get rid of these muscles that are attaching back here. You can kind of see all these muscles that are up through here. But also, let's go on this side just so you know. Here's the nerve right there that I'm talking about. There it is. That nerve. So this nerve supplies movement to that area. And so if this nerve is irritated going down into there, you're going to notice. So a lot of people will like mash out and roll this muscle out, but they're also irritating the nerve. And it's not wrong to help the symptom, but it is wrong to treat just the symptom without treating just the problem. Well, you have I don't want to say a complex injury. You have a very common injury, but you have multiple components. So the question, as I was stating before, is what the heck do we treat first? Do we treat the shoulder that's causing some of the neck issues? Is it a neck issue causing some of the shoulder issues? Or do we just kind of have to swing for the fences and try to hit both of them? That's a good question. It's a very good question. And the only way we're going to figure that one out is by troubleshooting both of them. Now, here's the other question. I'm going to actually have to send you another neck index for you to fill out just so we know what's actually happening. Would you say that the neck hurts more or the shoulder hurts more? Okay. Okay. So so up through here is where you're having a lot of the pain. Okay. Okay. So when you have that movement, you more than likely will have that shoulder pain, as we said, that doesn't pass past here. But when you do head and neck and shoulder movements at the same time, that's when you'll have them go down all the way into the arm, down through there. So yeah. So I would say for you, then I would say let's start with more of a mild or moderate focus for the shoulder. When I have you fill out that neck injury thing, I'm gonna have you decide, and then I'll decide. Or sorry, I'm gonna have you take the survey. I will decide on which one we should like. Maybe do 3 exercises for the neck instead of 3 exercises for the shoulder versus 2 exercises and for the shoulder and 2 exercises. What I'm saying is that the shoulder pain likely created more tension into the neck, which then creates more nerve irritation, and then because of the lack of mechanics or the presence of this rolling forward, it creates more strain on the back end back here, and puts more strain back here. And so I personally think that your shoulder injury is a driving force, but you never see them independently. It's just, and especially when it's like you said, it's going on for a while, so quite a while. So we need to start this a little bit sooner. And if you're having more headaches sooner, we need to really hit this harder at first. So you have, I will say though, with frozen shoulder syndrome, that external rotation that we talked about going backwards is usually the hardest to get back. So do not freaking focus on that. Do not like it sometimes takes months, sometimes a long period of time, and it is also the most vulnerable position for the shoulder when your shoulder is out in this. Here's your hands. Well, let's just pretend that's your hands. You know, if your shoulder's out. Yeah, we'll have to focus a little bit on all